Hello, my name is David Trimberger, and this is Molly Hall, and we are going to be completing my instructor checkoff for trauma adult physical assessment. So what are we being dispatched to?
28-year-old female in a motor vehicle accident.
28-year-old female in a motor vehicle accident. Okay. What is the credentials of my partner?
EMT.
EMT. Where exactly am I being dispatched to?
A highway.
To the highway. Okay. And then what time of day is it?
4 p.m.
4 p.m. And then what's the weather like outside?
Sunny.
Sunny? Okay. Has police and fire already been dispatched?
Mm-hmm.
Okay. Is police on scene?
Yes.
Have they started already trying to clear off the roadway?
Mm-hmm.
Okay. Is fire on scene?
Yes.
Okay. Has fire been able to stabilize the car yet?
Yeah.
Okay. So in that case, as I am trying to approach, what is my patient presentation?
Patient sitting in the driver's seat. The airbags have been deployed, and the patient was wearing a seatbelt.
The patient was wearing a seatbelt. Do I notice any signs of steering wheel deformity or spider web to the windshield?
Mm-hmm.
No? Okay. So then in that case, BSI, is my scene safe?
Yep.
Okay, I'm going to go up to my patient and does my patient look at me whenever I approach?
No.
No? Okay. So then in that case, I'm going to go over to my patient and I'm going to kind of gently go over and shake them and be like, or actually before I would do that, due to the nature of the call and kind of everything that is going on, I'm going to go ahead and instruct one of the firefighters to hold C-spine precautions. Go ahead and hold C-spine precautions on my patient. Then I'm going to go over to her and be like, ma'am, can you hear me? My name's David. What's going on? Do I get any response?
No.
Okay, I'm going to go over to her trap, going to pinch really hard. Do I get any form of a painful response?
Nope.
Okay, so in that instance, I would assume that I have my patient is being unresponsive with the GCS of 3. So I'm going to do, instead of ABCs, going to go to CAB. So I'm going to go ahead and check a carotid pulse. Is a carotid pulse present?
Mm-hmm.
Okay, then I'm going to check for a breathing rate. Is her breathing pattern, or is she breathing?
No.
She is not breathing?
No.
Okay. And then also before that, I would have checked the airway. Is her airway clear? Okay. So she has a carotid pulse, her airway is clear, but she is not breathing. Is that correct? Okay. So then in that instance, we need to rapidly try and get her out of the car and begin to start trying to breathe for her. So I'm going to instruct the firefighters to rapidly extricate the patient. Go ahead, put a seat collar on her. Before we did that, I want to quickly go over and just assess the neck. So does she have any JVD or tracheal deviation?
No.
Any step off to the back of the neck?
No.
Okay, we'll go ahead and put that seat collar on her, have the firefighters rapidly get her out of the vehicle, and we'll go ahead and put her on a backboard. Before we would put her on a backboard, we'll go ahead and get her trauma naked. And then I want to go ahead and check her posterior side for any signs of decap, BTLS, or any other deformities or anything.
Minor contusion to the lower spine.
Minor contusion to the lower spine. Okay, so we'll go ahead and put her on the backboard, quickly get her onto the stretcher, quickly get her to the ambulance. That way we have a more controlled scene. As we're in the back of the ambulance, I'm going to try and recess. So I'm going to go over to my patient. Ma'am, can you hear me? Can you hear me? Does she respond?
No.
Okay, going to check for a painful response one more time. Does she respond at all? Okay, I'm going to check my carotid pulse one more time. Is my carotid still present?
Yes.
Okay, going to check the airway. Is the airway clear?
Has a small amount of blood.
Has a small amount of blood. Okay, so I'm going to go ahead and prepare my suction machine. I'm going to suction out the airway. Is my airway clear?
Yes.
Okay, I'm going to go ahead and find a properly sized OPA, and I'm going to go ahead and insert it. And then I'm going to assess my breathing rate. Is my patient breathing at all?
No.
Okay. Since my patient is not breathing, I'm going to go ahead and auscultate kind of quickly over the lungs. Do I hear breath sounds on either side?
On the right side, yes. You can't hear him on the left side.
Can't hear him on the left side. Okay. So due to diminishing lung sounds, inability to maintain one's own airway, and having a GCS lower than 8, I'm going to go ahead and prepare to intubate my patient. Due to kind of also all the craziness that's going on, I'm going to ask for one of the firefighters to be a rider and go ahead and be kind of like an additional resource in my ambulance. And also, before we would have gotten out of the ambulance, I would have put on my bright neon vest to make sure that we'd be properly safe on the highway. So I would go ahead and prepare to intubate my patient. So I would intubate my patient, and then I would confirm proper placement by auscultating over the lungs and the epigastrium, as well as connecting them to a capnography to make sure that I'm getting proper breathing patterns. With confirmation, did I place the ET tube correctly?
Yes.
Okay, so I'm going to instruct the firefighter to go ahead and ventilate my patient at a rate of 10 to 12 times a minute. Am I starting to see adequate chest rise and fall?
Yes.
Okay, I'm going to re-auscultate over the lungs because you said I had diminished lung sounds on the left side, is that correct? Okay, so I'm going to re-auscultate over both of the lungs. Do I hear air movement on both sides?
Still diminished on the left side.
Still diminished on the left side. So in that instance, I'm going to go ahead and prepare for a pleural decompression. So I'm going to find the midclavicular line, going to go to my second or third intercostal space. So find my space, clean the area, going to go ahead and decompress the chest. As I advance the catheter, do I hear any form of air movement, or my syringe, does the plunger begin to kind of push back? Yes? Okay. So once that happens, I'll go ahead, take my needle, put it in the sharps container, stabilize my catheter. Then I'm going to re-auscultate over the lungs. Do I hear air movement on the left side now?
Yes.
Okay. And then I'm also going to be and I am now able to see adequate chest rise and fall with the ventilations. Perfect. So now that I have done all that, I'm going to do a rapid head to toe on my patient. So also I'm going to do just a quick general blood sweep. Do I see any obvious signs of bleeding as I'm moving along her body?
No.
Okay, so I'm going to be starting off with the top of the head with my rapid trauma assessment. At this time, I would also instruct my EMT partner to go ahead and place my patient on the monitor. So I'm going to be connecting her to heart rate, blood pressure, SpO2, blood glucose, capnography, and I'll go ahead and connect her to a 12 lead. And then I'm also going to, if she was conscious, this is whenever I would want to be trying to do a sample history, and then this is also where I would want to be wanting to make my transport decision. So due to the nature of everything, I want to go ahead and take us to a level 1 trauma center. So for the state of Oklahoma, that would be OU. So starting from the top, doing those three things at the same time, with my partner connecting them to the monitor. What is their heart rate?
120.
What is their SpO2?
98.
98, okay. And also with my firefighter that's ventilating my patient, I would go ahead and connect the BVM to 10 liters of oxygen, just help ventilating my patient. Then what is her respiratory rate?
12.
12, okay. And then what is her blood pressure?
100/70.
Okay. And then what was her blood glucose?
88.
88, okay. So then as I would be doing that, I would try and see if I could assess for a sample history. Since she's unconscious, that isn't able to happen. So I'm going to start with my rapid head to toe. So starting with the top of the scalp, I'm going to be assessing for any signs of decap, BTLS, anything with the scalp.
Mm-hmm.
Okay, going to go down to the eyes, check a pupillary reaction. Is her eyes perla?
Yeah.
Yes, okay. Then I'm going to, is her nose in line?
Yes.
Okay, any damage to the oral cavity?
Mm-hmm.
Okay, I'm going to be assessing behind the ears. Is there any battle signs or drainage coming from the ears?
Mm-hmm.
Okay, is the nose in line? Okay, now I'm also, we have the C-collar on, but before I did that, I went ahead and checked the neck. Next, I'll be going down and assessing the chest. Is her sternum in line?
Mm-hmm.
Okay, does she have any TLS or anything around the rib cage? Okay,
No.
going to re-auscultate the lung sounds. Am I still able to hear air movement on the left side as well as the right side?
Yes.
Okay. Next, I'll be moving down to the abdomen. I'm going to palpate all 4 quadrants as well as listen to gastric sounds. Is everything present?
Mm-hmm.
Okay. Going to check to see that the pelvis is stable. Is the pelvis stable?
Yep.
Okay. Now that my pelvis is stable, I'm going to check the extremities. So CMS times 4.
Mm-hmm.
Okay. Is there any decap, BTLS to any of the extremities?
Nope.
Okay. So now that I have all that information, I already have them on a 12 lead. I have my vitals taken. In that instance, I would go ahead and I will start 2 bilateral IV. So I'm going to try and do a large bore IV. So I'm going to try and do 2 16 gauge IVs into the ACs. Am I successful?
Yep.
Okay. Then after that, I have started IVs. I have completed my assessments. I'm going to go ahead and call OU, let them know that we're coming. Go ahead and give my patient care report, and then I'm going to monitor my patient every 5 minutes while I'm en route to the hospital. So is there any change in patient condition while I'm en route in the hospital?
No.
Okay. So with that information, then I will go ahead, bring my patient in, give report at the patient bedside, and then transfer care to the OU nursing staff. Thank you.